Hi, welcome back. In this section, we're going to learn a little bit about the electrocardiogram and how it correlates to what's happening in the heart. So let's get started. So the electrocardiogram, also known as the EKG or ECG, basically shows us what direction the electrical currents are traveling in the heart. And in order to do that, we have limb leads as well as precordial leads. So there's 4 limb leads, one on the right upper extremity, the left upper extremity, and the left lower extremity, which are looking at voltage patterns. And then there is a grounding wire on the right lower extremity. In addition to that, there are 6 chest or precordial leads, which go around the anterior surface of the heart, going from the right side towards the left side. Now, remember that the heart doesn't sit straight up and down like a box. It is angled as well as rotated slightly. And then from these 12 leads, from these different recording devices, 6 on the chest and 4 on the limbs, we get what we call 12 EKG leads, which are basically looking at patterns of flow from one monitoring spot to another. So for example, this picture on the left is showing you 6 of the various leads. The one lead that we use more than anything else is called lead 2. And this is going from the right upper extremity towards the left lower extremity, which is almost parallel to the interventricular septum. And so that's the only part of the EKG that we are looking at in this course, just the one lead 2, which is also known as the rhythm strip. So the difference in currents, whether it's going towards it or away from it, gives us the impulses either going upward on an EKG, a positive deflection if they're going in that direction, or below the baseline, a negative deflection if they are going opposite direction. So in order to understand that, let's just take a moment to review depolarization and repolarization, where the whole electrical activity of the heart starts in the sinoatrial node, way up high in the right atrium next to the opening of the superior vena cava. From there, an impulse is going to travel throughout both atria through the internodal fibers. The impulse will reach the atrioventricular valve, which is just above the tricuspid valve, just above the fibrous skeleton of the heart, and a new impulse is generated from here, which then travels at a slight angle to get into the interventricular septum through the bundle of His. After this, it bifurcates, and we have the right bundle branch and the left bundle branch traveling down the interventricular septum and then going up the outer aspects of the 2 ventricles. And it's not just 2 lines. Remember, it's going to be in 3D. So don't just think, oh, it's just one line like this, and then from there, we're going to have Purkinje fibers going everywhere else. No, it comes down like this, and then it branches out like that. Okay. So coming off those bundle branches, we have the Purkinje fibers, which actually go to all the cardiomyocytes. So realize that depolarization is going to go towards the apex, and then it's going to go away from the apex in the ventricles. So looking at the EKG, an upward or a positive deflection from the baseline, how far it goes represents how much voltage is happening. So because there's more voltage in the ventricles, there's more cells contracting, then the waves for a normal ventricle are going to be quite a bit higher than the waves for a normal atrium. And then, of course, we have the time across the x-axis. So that gives us the typical contraction with the P, Q, R, S, and T waves. So from the beginning of the P wave to the beginning of the Q wave, this is representing atrial depolarization. The QRS wave represents ventricular depolarization. And then from the S through the T, and possibly there's a U until the beginning of the next P wave. That is the long amount of time, which represents the amount of time in which there is ventricular repolarization. I also want to point out that yes, there is atrial repolarization, but it happens at the same time ventricular depolarization is occurring. So it is hidden behind the QRS complex. All right. So in addition to those waves, we have intervals, complexes, and segments, and we're going to learn one of each of them. The first one is the PR interval, which is kind of a misnomer. It's from the beginning of the P wave. So once it leaves the isoelectric line, it starts going in a positive deflection to the beginning of the Q wave. Okay. Now, all those 12 leads, not all 12 are going to have Q waves, but if there is a Q wave, like there is typically on lead 2, you do not include the amount of time of the Q wave in the PR interval. And what this represents the amount of the delay that ventricular contraction is going to have. This is just when the atrial contraction. So this is letting ventricular filling happen, coming from the atria being contracted. The QRS complex, which is from the beginning of the Q wave into the end of the S wave, this is representing when ventricular depolarization is occurring, where we're having that impulse travel down the interventricular septum and then it goes back in an upward direction. And then the ST segment is going to be during ventricular repolarization, and in a normal heart, this is a flat line on the isoelectric line, followed by a T wave. So now that we've learned about the EKG, and after you have spent time and you're sure you understand the cardiac cycle, we need to put these things together. So let's start up here at 12 o'clock where it says start, and we are going to have an impulse coming from the SA node. So we are going to be having atrial depolarization across both atria, represented by a P wave occurring. And obviously, as a result of the atrial depolarization, we're going to have atrial contraction occurring. So we have finished the P wave, the impulse has arrived at the AV node. We are then going to start sending the impulse down the bundle of His, giving us a Q wave, and then it will continue down the interventricular septum and the two bundle branches. So we will start this process of ventricular depolarization, and that's going to give us a quite significant R wave as far as voltage is concerned. Now remember, at the same time atrial repolarization is occurring, we just don't see evidence of it on the EKG. Once the depolarization has reached the apex, it's then going to travel around the outer circumference area of the heart and depolarize all of that, as evidenced by an S wave. And then this is almost immediately followed, starting at the apex and working upward, with ventricular contraction. So ventricular contraction does occur during the RS part of the QRS, and it also continues after the S wave while you have an isoelectric line in the ST segment. Ventricular repolarization then occurs as evidenced by the T wave. At the end of ventricular repolarization, the entire heart is in diastole. Nothing is depolarizing or repolarizing, as evidenced by an isoelectric line, until we have the next contraction. So stop this video, go over it several times until you're sure you know it. And I have some other videos which are linked, which are excellent videos put out by a medical media company. So apologies for having their copyright in the middle of it. But there's a really good one on the phases of the cardiac cycle, and an excellent one on understanding the EKG and the cardiac conduction cycle. So that's it for this section. Please do not continue until you have mastered this material. Thank you so much, and I'll see you as we continue our exploration of the heart.